Good afternoon, everyone. My name is Tommy Smith. I'm with Kaiser Permanente's National Supplier Diversity Program. We are a part of the Procurement and Supply business unit within Kaiser Permanente. And as Michelle said, my presentation is slightly different. I'm here to talk about how a large enterprise such as Kaiser Permanente, through their behavior, can impact the the ecosystem for community entrepreneurship. So first, let me talk about the organization. Kaiser Permanente is the largest nonprofit integrated health plan in the United States. We have 37 hospitals throughout California, Oregon, and Hawaii. Throughout the nation, we have 600 medical office buildings, about 16,000 physicians, 178,000 employees, 9 million members, and $51 billion in revenue. And while we are a large enterprise, we are a mission-driven enterprise. And our mission is to provide high-quality, affordable health care to improve the health of our members and the communities we serve. So given that context of such a large enterprise dedicated to health care, why do we care about supplier diversity? And first, let me define what supplier diversity is and give you a little background. Supplier diversity is the inclusion of minority, women, veteran, and small businesses within your procurement and supply chain. It started about 40 years ago based on regulatory requirements. Those people who did business with the federal government had regulations to meet. But Kaiser Permanente cares about supplier diversity not solely based on regulations, but it's a business choice for us. As healthcare is implemented in the United States, affordable healthcare is implemented in the United States, we find that most of the new entrants into healthcare come from diverse populations. Here in California, where a majority, at least 80% of our business is, 75% of the new entrants into the healthcare system are minority populations. So for us, supplier diversity is about buying behavior. It's about organizing our supply chain and using our purchasing power to create community development through job growth and among small businesses and individual healthcare consumers located within our operational footprint. So supplier diversity, when we strategically channel our purchases to diverse suppliers, small, local, minority, women, veteran-owned businesses that might not otherwise come to our attention based on their size, their location, their scale, or unconscious biases. Kaiser Permanente strengthens the economic environment of our current and future members, which helps promote thriving communities, increasing the social economic status and better education opportunities for those communities, which leads to better wealth, which we hope leads to better health. And a stronger America. Now, we're talking big numbers. Kaiser Permanente had made a goal and has met a goal to spend $1 billion of its procurement spend with minority and women-owned businesses. We met that goal as of December last year. We actually exceeded it, and so we spent $1.3 billion spend with minority and women-owned businesses in 2013. But let me break that down into bite-sized chunks that we can relate to. So here is Marie Lay, and she's the president of Freshen Natural Food Groups. And they provide food operation services and catering to some of our local facilities here in Northern California. Her company is a small, local woman and minority-owned business. Some of the local impacts, as we hoped, is that she hires local employees based on where she operates and has been able to support employment through her contract with Kaiser Permanente. And because she has a contract with Kaiser Permanente, she's able to have the revenue to grow her business with other customers, large institutional customers. And through our example, Kaiser Permanente is about Thrive. And so our other suppliers, other folks within our business community get that message. And they are also looking at fresh and natural foods as a supplier to them for healthy food choices. Oh, and they're also Kaiser member now. Derek Bennett is president of D&D Painting, and his company is actually working. They have the painting contract for our new Oakland facility, and it's actually not that far from here, about a mile from here. We're building 3 new hospitals in the area. The Oakland facility is going to be our kind of cornerstone institution here in Northern California. So Derek, directly because of his contract with Kaiser Permanente, added 6 new jobs and has been able to grow his business 35% due to the opportunity with Kaiser Permanente. And Derek gives back to his community. He's a great business to support because he's developed an apprenticeship mentor program and also mentors other small businesses. And yes, they are also Kaiser members. So with that, I'd like to thank you for your time and attention, and I hope you have a great rest of the afternoon.